Now to what could be the beginning of the end in the fight against COVID. Hospitalizations, cases, and deaths continue to fall nationwide. And for the first time in 2 months, new COVID infections have dipped below 100,000 per day. But we've seen this movie before when the data trends in the right direction, only to be reversed after the holidays. The difference this season, we have widely available vaccines. At this moment, however, just 66% of all eligible adults are fully vaccinated. And the CDC says the majority of doses being administered right now are boosters, not first-time doses. A new group could soon be eligible for the shot, though. Pfizer has officially applied for emergency use authorization for its vaccine in kids ages 5 to 11. If authorized, it would be the first COVID vaccine for kids that young. The sad reality, if their parents aren't getting vaccinated, they likely won't get the vaccine either. That is a sad reality. And joining me now, the director of the National Institutes of Health, Dr. Francis Collins. Dr. Collins, great to have you on. We appreciate it so much. On Tuesday, you announced you'll be stepping down from your post. I'm sure that came as a disappointment to a lot of Americans out there who have had you on their TV screens for so many months during this pandemic. But I want to ask you about when you got this job in the first place. There was some pushback, as you might recall, over your faith as an evangelical Christian and how it might factor into your role as a man of science. But lo and behold, those two things can work just fine with one another. But based on your personal history, what is your message to evangelicals, other people of faith, using religion as a reason not to get the COVID vaccine? If I may start there.
Well, it's a good question. Yeah, you may indeed. Let me first say it's just been an incredible privilege serving the nation for more than 12 years as the NIH director, serving 3 presidents, trying to keep medicine out of politics, usually successfully. But yeah, we do still now have this serious issue right now about vaccination hesitancy, and certainly evangelical Christians, and I am one of those, have had a lot of trouble in many instances rolling up their sleeves. Lots of reasons for that. Much of it is this disinformation that is so widely spread on the internet and which has, I think, caused a lot of people to be confused or fearful about what the vaccinations might do to them. And that is truly heartbreaking when we see still more than 1,000 people losing their lives to this disease, almost all of those unvaccinated, and therefore didn't have to happen. Christians, of all people, are supposed to be particularly worried about their neighbors. And this is also a really critical situation where if you're not vaccinated, you may be the one spreading this virus to somebody vulnerable who can't necessarily resist it. So once again, let me make a plea right here. If you are a Christian or if you're anybody who has not yet gotten vaccinated, hit the reset button on whatever information you have that's causing you to be doubtful or hesitant or fearful, and look at the evidence. The evidence is overwhelming. The vaccines are safe, they're effective, they can save your life.
And I have to ask you, Dr. Collins, at church, have you had these conversations with fellow parishioners about this sort of thing?
I have not been in. Yeah, I have not been in an actual face-to-face church service for this whole time because of the risks of being indoors. So all of my church experiences are virtual, but I have lots of opportunities to talk to other believers. I've done podcasts with Rick Warren, with Franklin Graham, with Walter Kim, with Tim Keller. All of these are pastors who have a big reach out there. And there's a wonderful set of videos from Pastor Curtis Chang that basically tackles all of the misinformation and provides reliable evidence based on science. And people should look at that too if they're still not quite sure what the facts are and they want to hear from a pastor.
Okay, good. I'm so glad we touched on that. But let's move to the big headlines right now. Cases, hospitalizations trending down. We've seen this movie before, as we were just saying. But is the worst of the Delta surge finally behind us, do you think?
Well, if you just look at the shape of the curve, you would say we went over the top, which was a terrible top, and we're starting downward now. But I can't be absolutely assured how steep that downward slope will be or whether we might encounter another bump. So this is not the time for people to let down their guard. We are in a circumstance where there are more people gathering indoors, cold weather's coming, schools are in place. So it is an opportunity for this virus, and we should think of the virus as the enemy, not anybody else, to have a party and to take advantage of those moments where we begin to think we're okay. We are not yet okay. I know people are tired of hearing that. I know they're tired of having to wear masks when they're indoors. I know they're tired of all of the arguments that are going on about masks in schools, which certainly have a lot of science behind them. But this is not the moment to say, okay, we're done. Like you say, we went to that movie before. It didn't have a good ending. This time, let's try and do it right.
Yeah, and once the Delta wave subsides, and let's hope it does, unvaccinated people may feel less urgency to get the shot. Already the number of first doses administered has plummeted. Are work mandates and school mandates the best way to combat this and to prevent future surges? What are your thoughts?
Jim, I think they are. I was slow to come around to mandates. I really hoped we wouldn't have to go there because the evidence was so compelling. It was hard to imagine why people would turn down this opportunity for something potentially life-saving. But we are in such a bad place in our country where truth doesn't seem to actually have as much influence as somebody's opinion or somebody's Facebook post. And if it takes mandates to get us past this, because the country isn't going to get past it with the current level of vaccination, then let's do the mandates. Let's ask people to do the right thing, even if it's not something that was quite the way I thought it would happen. I run an organization of federal employees. They're all going to have to be vaccinated by November 22nd, or we're going to have rough conversations about letting people go.
I was told to eat my Brussels sprouts when I was a kid. I mean, I had to do it. I had to eat the broccoli. That's how I was raised. So, you know, it's sort of like the same thing. Speaking of that, a new study shows children are as likely to be infected with the coronavirus as adults, and that kids only show symptoms half the time. This is something that it kind of hits at a misnomer that a lot of people have. They think, well, kids aren't showing these symptoms, so kids are just fine. They're immune from all this, when that's just not the case. But as we await authorization for Pfizer's vaccine for kids ages 5 to 11, what do you say to parents who would rather play the odds than get the kids vaccinated?
I would say, like every decision you make, what's the benefit and what's the risk? If you're worried about playing the odds, what really is the risk we're talking about here? And the evidence makes it clear these vaccines are remarkably safe. And what's the benefit? Yeah, 540 kids have died of COVID-19. Walk into any pediatric ICU right now in a hospital, you will see children who are severely ill with this disease. The myth that kids really don't get this severely needs to be wiped out and replaced with the reality. So just balance those things. Why would you say, oh, I'm not going to do this? And unfortunately, already, you know, kids 12 to 17 have been eligible for vaccines now for several months. We have only about half of them that have actually received the dose because their parents are holding back. Come on, parents, look at the data, figure out what's best for your kid, and then try to make a decision based on that evidence, not something that somebody told you based on some crazy rumor. There's too many of those. You know, this is the thing that really bugs me and worries me, Jim, about our country. We have two epidemics going on. One is called COVID-19. The other is an epidemic of dangerous disinformation that is causing reasonable people who care about themselves and their families to make bad decisions. This
really
is heartbreaking. It never should have come to this.
No, I agree with you. That is so right. And I have to ask you, I want to ask you one more personal question, if it's okay, if I may. Throughout this pandemic, your friend and colleague, Dr. Anthony Fauci, has faced death threats. He's talked about it on CNN and other places. I'm wondering if you've gone through the same thing yourself and what that has been like. I think I know the answer to the question, but I'm just wondering, it touches on this disinformation problem that we have in this country, and why people, when they get infected with this disinformation, feel like they can lash out at people. And I'm just wondering if you've gone through that yourself.
Yes, I have. Not at the same level that Dr. Fauci has, which requires him to have 24/7 security. But I've had knocks on the door at 1 o'clock in the morning from the police saying you might want to be extra careful. I've received emails that are really hard to read from people with such venom lashing out at somebody they've never met based on something they heard that they didn't like. Gosh, America, how did we get in this space? If we could at least be civil, that would be a good start. But better than that, let's seek out the truth and then try to make decisions on that basis.
And I think if people had a better understanding of who you were as a person, if they knew what you went through in getting this job, that you had to overcome these concerns about your faith and bringing that to the job. And so I wonder if that might have helped people say, okay, if Dr. Collins is saying it, I'll take it as gospel, so to speak.
Well, you're very generous to imagine that would help. But I'm so privileged. Don't make it sound as if I've done this big sacrifice. Being a public servant, and I hope there are some young people out there listening who are wondering about their career. Being a public servant can be one of the most satisfying, rewarding things you can do. You may not get paid very well, but you'll have the satisfaction waking up every morning that you're doing something that matters. You're helping people. That's the joy I've had for 12 plus years.
Well, thanks so much for doing it. You've done a tremendous service to this country, and we appreciate you coming on, Dr. Francis Collins. Thank you so much.
Thanks. I'll come back anytime. I'm not quite gone yet. Give me a couple more months.
All right. We won't push you out the door just yet. All right. Thank you, sir. Appreciate it.